Hi, and welcome to the Navigating Neurodiversity podcast. I'm Vivian, registered psychologist, and today we're very happy to welcome Dr. Amanda O, clinical psychologist from Budding Space, to join us. And we're going to be chatting about the topic of highly sensitive traits in individuals. So a bit about Amanda first. Dr. Amanda supports individuals with issues ranging from trauma, stress, mood disorders to OCD, as well as other mental health needs. So before diving into the topic, Amanda, I thought that we could talk a little bit about the difference between a clinical psychologist and an educational psychologist, because I know these terms can be a little bit confusing to some of our parents sometimes. And I think, we were chatting about this earlier, and we were just saying that there's actually a lot of overlap in the work that we do. So for example, both myself and Amanda, we would do assessments for individuals, suspected of having ADHD or autism. So in general, I think we could say that for educational psychologists, our training does focus a bit more on the school context. So, supporting students with learning or behavioral challenges, helping them thrive in a school setting and environment. We probably do a bit more of collaborating with educators, especially during our training and practicum. So collaborative approaches with teachers, as well as identifying strategies that would work well in the school settings. For clinical psychologists, I'll invite Amanda to share as well, but I think they focus more on mental health, mental wellness. So for example, if I had a client who was facing more significant mental health concerns like trauma, depression, OCD, I would typically refer them over to a clinical psychologist like Amanda or a psychiatrist. Yeah. How about you, Amanda? Like maybe you could share a bit more about the work you do, and then when would you refer a client to an educational psychologist?
So first off, thanks for having me here.
Thank you for coming.
So in my training as a clinical psychologist, essentially our training is it's all encompassing in the sense that we are trained to treat mental health conditions across a lifespan, from children as young as 2, 3, 4 to as old as the geriatric population. But because of that, I think a lot of us may not feel, in terms of time constraints and all that, we may not have that resource to specialize in every condition that these population will bring to us. So while we may be technically equipped to provide services to people across the lifespan, I have to say, at least I speak for myself, I don't feel specifically specialized in every aspect of that intervention or that support. So for us, while we may be trained to do assessments for, learning difficulties and also behavioral difficulties, I prefer to refer them out to educational psychologists because, like you say, you are specialized in this area of support and intervention. You have the knowledge and also the depth of understanding to support people with these kind of difficulties. So I might be qualified to provide those services, but it is useful to have a multidisciplinary team to kind of help support that client. Likewise, the same applies to medication, or in this case, clinical psychologists. We are not legally allowed to kind of prescribe medication because we are not medical doctors by training. Even if we have a doctorate, it's a doctorate in psychology, not in medicine. So we do also rely on psychiatrists to provide that medical support, the psychiatric support. So same with childhood. So I think there's a developmental psychologist as well. And these people these professionals specialize in providing behavioral treatment or behavioral interventions to very young children, perhaps in preschool age.
Thanks for that, Amanda. Okay, so we're going to dive into the topic of highly sensitive traits in individuals. So maybe we'll start with some definitions first.
Sure.
How would you define this? Because I think that's something that we see, I see in my clients as well, who are very, very highly sensitive. What's the definition that you kind of reference, when working with these individuals?
Okay, so I think the term that we use in the professional setting is HSP, highly sensitive person, or highly sensitive personality trait. And basically, it's a person who experiences their environment including, the physical senses as well as the environmental sensory inputs, as well as the emotional and social experiences. They go through all of that with heightened awareness. So if you imagine them as like maybe a very porous sponge. So there are sponges that don't absorb water very well, and then there are sponges that absorb everything around them very quickly.
Yes.
So they're the very porous one that just absorbs everything in their environment.
Yeah, that's great.
So
analogy.
and with that, you can imagine that they would be very easily overwhelmed. They carry a lot in them, and for people who don't know how to filter or set boundaries and differentiate what's their stresses and what's from their environment, these people tend to then be at risk of becoming overstimulated. So that is very different from somebody who's perhaps sensitive because of, certain traumas, unresolved traumas, and they have certain triggers. Because then for these people who are sensitive to a trauma-related reasons, they tend to become a lot more triggered in specific situations that's related to their unresolved trauma. Then there are also people who have sensory processing disorders. Well, that's not it's not a condition in the DSM, in the Diagnostic Statistical Manual.
Neither is HSP, right? So
exactly. So, but then it is something that I think it's the occupational therapists. They work with people or with children with this condition. They kind of understand the difficulties with this category, this label of SPD. So people with sensory processing disorder, I think a lot of the difficulties are mainly from the physical overstimulation as well as the environmental stimulation. So that would refer to like tactile stimulation, oversensitivity to maybe the tags or the type of texture of their clothing,
or the tree,
or else it's like loud noises, very bright lights. And the problem with people with SPD is that their bodies aren't able to the problem for the people with SPD is that these people are not able to then respond in an adaptable way to this stimulation.
So it's really the processing of sensory input from the environment.
So if a person comes across loud noises and they have SPD, then they can't function, they can't exist in this setting, and that could mean that they can't attend schools, they can't, walk by the roadside. So all of that, you can imagine, have an issue, would have an impact on their quality of living. But for a person with HSP, who's a highly sensitive person, while they may feel overwhelmed by loud noises, they are still typically able to respond and function in an adaptable way in these kind of situations. And it's only when the overstimulation sets in, that's when they perhaps will present with regulation difficulties, behavioral issues, stuff like that.
Right. So when it crosses the threshold of their ability to manage. So we don't see it as a disorder per se, right? Do you think of it more as like a processing style, a form of maybe neurodivergence?
Okay, so the term HSP is typically referred to as more like a trait, a personality similar to introversion, extroversion, neuroticism. And I like the shift in the psychology industry now, where they are trying to move things away from disorder, being known as a disorder, to being no more like a trait. It's more like a spectrum. We are all on the spectrum to some extent, in varying degrees, right? So if you think about it more like a trait, then it's really suggestive that, it's your personality, is how you're wired. There's no good or bad thing about it. It's about how we manage it, how we work around that, or how we promote understanding of this particular trait and support the person with that trait so they flourish better.
Absolutely. So it's not a disorder, but we do see that some of our clients, the fact that they have reached out to psychologists. I think some of them do have problems managing, and the fact that they're highly sensitive could have created some challenges, maybe for the kids in school, in certain settings, or, sensitivity to rejection, or criticism,
Yeah. So earlier on, you were asking if this is something that you see a lot in neurodivergent people, right? Like people with ADHD, autism.
Yes.
Even people with high intelligence, I would say they fit in the neurodivergent category.
Yes.
I would say that while they're not the same thing, but people who are a bit more neurodivergent are more prone, perhaps, to having highly sensitive traits.
Yes. So a bit of like a correlation.
There's a correlation. There are some studies to suggest that HSP is genetic, but then I think a big part of it is also nurturance. So that's why, when we talk about whether it's a disorder or a trait, sometimes it's more helpful to think about it as a trait rather than a problem, a disorder, because then there is something we can do to kind of ensure that this person with this particular trait gets to flourish through nurturance, through the right or the appropriate way of nurturing the individual.
That's right. So the approach is not about treatment
not so
or
much
getting
about
them to, change this trait, but
exactly.
supporting them such that, they can function well in their lives and so on. Yeah. Yes. So you talked a bit about the nature and nurture. What do you think, because, I hear from parents, like some of the HSPs that we see, the traits are actually obvious since the child was a baby. For example, they would say, the child has been fussy since young, refused to be strapped into car seats, would have a lot of meltdowns, tantrums, and things like that. So it could start at a very, very young age. Do you see them progressing on? Like, do highly sensitive children grow up into highly sensitive adults?
So yes, they do grow up into highly sensitive adults, but the way the sensitivity is then manifested will differ based off of how they were nurtured growing up. In the sense that, if I were to give an example, if a child with high sensitivity needs as perhaps a toddler having difficulties getting strapped into the car seat, perhaps certain food don't go well with their palate, they reach a very picky eater, cannot sleep well at night without perhaps certain people around or certain safety toys around. So all these things could are potential opportunities for perhaps parents to feel frustrated, right? Because it's very demanding. To be fair. But then if, say, the child develops a secure attachment because their caregivers do not rely on perhaps punishment in response to their sensory needs and instead provide consistent caregiving and attention in a neutral or positive way, then what happens then is the child develops a positive relationship with their sensitivity, and they would then manifest, they being the sensitivity would manifest differently in different phases of their lives. So for example, a teenager, we have to consider their different lifespan needs as well. If we look at Erik Erikson's psychosocial developmental milestones, a teenager would have needs for social interaction to individuate from the family unit. And in those kind of situations, a highly sensitive teenager would then perhaps feel a lot more courageous or be a lot more motivated to initiate interaction with people, with peers, despite perhaps their heightened anxiety or their sensory sensitivities to social cues, which could be overwhelming and could discourage other people or certain people from kind of initiating or initiating contact. And thereby, helping that highly sensitive teen to kind of develop social skills, right? Because of their good relationship with their high sensitivity trait. Now, the flip side is true as well for a child who is highly sensitive but was raised to feel that their sensory needs or their sensitivity was a problem, right? They then develop self-esteem issues, or then they develop a sense of mistrust within themselves about their needs as well as about the people around them. And so for a child like that, growing into their adolescence, entering teenagehood, these people would then struggle with social interactions
Yeah.
while still feeling all the distress that would come from having high sensitivity, because they would pick up the social cues. They would be very aware of the social dynamics that's going on around them. And highly sensitive individuals have a very rich inner life, because what do you do with all the information you take in, right? You analyze, you categorize, you try to make sense about them. So people with high sensitivity tend to have a very rich and deep reflective inner life. Yeah. So for those who are perhaps rejecting of their high sensitivity trait, they could then feel distressed by the fact that
Yes. So maybe that's great advice, right? And maybe to frame it a little bit more practically for our parents. So a common scenario might be a highly sensitive child who is maybe very sensitive to criticism or maybe correction of mistakes, right? So a parent might be coaching a child and just is saying that, this is not quite right, you need to do it this way. And then maybe the child gets quite worked up and sees it as, quite that you're criticizing me, gets very upset and things like that. How should a parent manage that kind of situation so that they could, really support the development and not come across as, creating a problem out of their sensitivity?
So first and foremost, parents have to understand their child's needs intellectually. They have to educate themselves on their children's, different sensory experience. And more importantly, they need to understand themselves and their own emotional needs. They need to know when they are approaching their limit in terms of emotional resources. And they need to equip themselves with the appropriate and adequate emotional coping mechanisms or strategies. So what this means is you need to recognize as a parent your own limitations and know what to do when you are approaching that limit before you even approach the child to kind of support them or to kind of nurture them, right? Because if you enter that interaction with your child overwhelmed, then essentially not only overwhelmed, but not having the techniques or the skills to manage your own sense of overwhelm, then what happens then? A lot of parents would externalize that frustration and the child receives it. Now, the thing about children is that, especially the younger ones, they tend to personalize negative feedback. They tend to personalize the distress of their caregivers. What that means is they tend to think that the cause or the reason for their caregiver's distress is them. And rather than think that, my mom's stressed or my mom is having a hard day, no, they tend to think that, okay, it's because there's something that I'm doing that's causing my parents to be so overwhelmed. So over time, such a consistent messaging to the child is going to impact their self-worth negatively.
That's right. Yes. Because I have parents who say that they literally cannot correct the child at all. Like even they do it very, very calmly, because I think what you say is true, because to you, you're just correcting, like, I'm just trying to teach you, that maybe your bihua is wrong, and so on. And they said no matter how nicely they put it, they're like, you did a really good job. Or maybe this part, you just do like that. No, they flip and so on. So it's really about maybe understanding the child's strengths and so on. But how would they be able to make these corrections, you think, without the child taking it so I mean, usually I tell them, do a lot of modeling of like, it's okay to make mistakes. Mistakes are part of learning and things like that. Is there anything else that we can advise them?
Okay, so what comes to mind is this label, this term called rejection sensitivity dysphoria, right? So we see that oftentimes associated with conditions like ADHD, autism, basically neurodivergent conditions. But then what rejection sensitivity dysphoria means is that for this person who has it, any sign of criticism, any sign of being dissed or being rejected, basically, will cause intense internal distress.
Yeah. So for the parent, you might just be, I'm trying to help you, I'm trying to teach you. That's your point of view. But at the receiving end, the child is seeing it as you're saying I'm no good, you're saying you're criticizing me and so on. And that's what's resulting in that intense
it could
reaction.
be that. Also another thing to note is that the flip side of RSD is called RRE, recognition, responsiveness, euphoria. So whenever a child is being recognized for their efforts, then they feel the opposite. They feel that glow of euphoria, of happiness, of joy. So what that means is that, while we give constructive feedback, we do, and, we try to be very intentional about the way we give feedback so that it's neutral. It may not be enough in some cases if we don't also look at whether or not we praise the child for a good effort and focus on the effort rather than the results. So if those two are somewhat balanced, then theoretically speaking, the child should take to the feedback in a more neutral way. We also then have to sometimes unpack the child-parent relationship. So imagine you're yelling at your child not picking up their clothes before they do their homework. Why your bag so messy? Right? And then sitting down with them and going like, okay, I'm going to be patient with you as I coach you. It's not kind of like setting a good precedence for what's coming, right? Your child would be hypervigilant already. Your child would be feeling distressed from the negative interaction or the all that criticism from before starting on their homework and stuff like that.
That's right. So that self-awareness is really important going into an interaction.
With HSP, RSD being very commonly associated in ADHD is actually shown to be more frequent in ADHD in girls, in females.
Because I think that reflects my experience as well.
So the issue here is that, we are still learning about ADHD in females, even in present times, because a lot of the research done in ADHD were done on boys. So you see the diagnostic criteria are also mainly observable in boys. But that's not to say that girls don't exhibit these criteria as well. They do, but more often than not, a lot more women experience ADHD difficulties and challenges, but they don't manifest the same way as those seen in the DSM. So what a lot of them have reported and what has been shown is that females with ADHD tend to experience RSD a lot more. And we are not sure. I don't think RSD and HSP are the same thing. I don't think the person who coined the term HSP, Dr. Elaine Aron, meant for them to be the same thing. But there are a lot of overlapping traits. And I think it could be that, if you have HSP, you will become prone to getting RSD. And since HSP is also shown to be very commonly seen in neurodivergent adults, we see that there are strong correlations around, but we don't know the causal mechanisms. And what that means is that, these individuals are not just sensitive to their the 5 senses, right? But they also have heightened awareness of the social and emotional sensory inputs. And if you have ADHD, for example, right, the research has shown that these people tend to receive significantly more negative feedback every day compared to a person without the condition. So this person is already struggling in day-to-day activities, feeling somewhat displaced, somewhat different, feeling distressed, but not knowing the words to articulate it. And then receiving negative feedback because of these neurological developmental challenges, and not knowing what to make of these feedback. And with the heightened awareness of people's facial expression, the social dynamics, the emotional distress that person is kind of externalizing towards them in that moment as they were giving the criticism. All of this is overwhelming, can be very overwhelming for the individual.
And I feel like there are 2 possible reactions to that. I see some clients maybe more externalizing, they might lash out, maybe the younger children as well, meltdowns, and so on. I also see clients who try to block it out.
Yeah.
And, almost like they would say, no, I don't feel anything.
Mm-hmm.
And it's really hard sometimes to engage in therapeutic work because they would say that what was going through your mind? Nothing. My mind was blank. And it's almost like they're trying to push those very difficult emotions away. Do you also have that experience?
Yes, I think we call that dissociation. Yeah, it's basically the mind's way of protecting the person in that moment. The mind is very powerful. It can dissociate in the simplest and most common of ways, like daydreaming, to very, very extreme ways, like splitting your personality and creating a dissociative identity disorder. So all of these are basically ruled by just one priority, which is to protect the person in that moment. So if a person or a child tells us that, I know it's distressing, it's supposed to be stressful, but I don't remember, I'm fine, I'm okay. It could genuinely be a dissociative response.
Sure, yeah. And I think that leads in really nicely to the next question I have, which is about trauma and how that relates with HSP.
Okay. So, based off of what we know already about HSP, which is that they take in a lot of information, whether they want to or not. What this means is sometimes their internal resources may not be enough, basically, to process and deal with whatever experiences that they're going through in that moment. So a psychological trauma doesn't have to be life or death. So that one, the life or death trauma, is basically your classic big T. We call it the big T trauma, right? It's also what we understand to cause PTSD, right? Post-traumatic stress disorder. However, daily experiences, daily occurrences can also be traumatic. And we call that the small T's. So the small traumas are the ones, I think, that kind of is a huge problem for people who are highly sensitive, simply because if they are lacking self-regulation abilities or skills, then that means that they're walking around basically every day absorbing all the stresses. So if any one incident catches them off guard, or if they happen to be in a state where they are so depleted resources wise, then that incident could very well become a small T for them, a small trauma for them. So for example, let me give you an example. If you put a 3-year-old alone at home, that child, compared to a 13-year-old alone at home, that same experience of being alone at home will be traumatic for the 3-year-old, but wouldn't be so for the 13-year-old, I would say typically. And that's because of the differing resources available to these individuals in that moment to deal with this experience. So if a person perhaps is pretty much okay with being criticized by his partner, all right, in any given day, but then, might find himself slightly traumatized by that, the argument with his wife if he had a really hard day at work or if he didn't sleep well that night. Same thing with students.
Exactly.
Criticisms from teachers, they may take it in stride most times, but then if, say, they were just rejected by a friend or, they were just, they just failed an exam, then perhaps an unkind remark from somebody, whether it's a teacher, a friend, or a parent, could then become traumatic for them.
Yes. I think, when we work with children and teens, we also talk to them about that window of tolerance, that your window becomes very, very small when due to all these other factors. You haven't slept well, accumulated stress over time and things like that. Okay. So, we've talked a lot about the challenges, right? Trauma, the link to neurodiversity. Maybe talking about the flip side as well. You talked about, high intelligence and things like that. What are some strengths that, also co-occur with individuals with HSP?
Very good question. So the thing is this, because they have so much access, right, to what's going on around them, they develop this natural tendency to be deeply reflective and have such a rich inner world. That would mean that, these are people who would be more empathetic. They'd be highly creative. Yeah. And like I said earlier on about their relationship with their sensitivity trait, if they do have a neutral or positive relationship with their sensitivity, then that's where this can flourish. So there is this analogy called the orchids and the dandelions. Have you heard of that? Yes. So the HSPs are the orchids.
Yes.
So they're very beautiful. And, they can be symbolic, and very expensive. Yeah, very rare, very unique. So a lot of people would kind of be drawn to them for their beauty and for their rarity. However, it's very hard to grow an orchid, right? So a change in temperature, a change in soil composition, the would not allow the orchid to grow at all. So that is your HSP. In the right environment, in a nurturing environment, they would flourish exponentially, more so than the average person. However, with the wrong kind of environment or a not so nurturing or a supportive environment, they would become a lot more affected as well negatively.
Yes.
So then the dandelions are the average person, right? We don't get so impacted by our environment, and we can flourish to some extent in a good or bad environment. But our growth is pretty much limited. So
so thanks for that. Yes. And I think, we've talked a lot about the role of parents, right? And how important it is that creating that environment that will help them to flourish. So maybe, could you share some tips with parents? Because up till here, there might be parents, watching and thinking, oh, that sounds a lot like my child. And they might be wondering, what are the things that I can do at home that would help and support them?
Okay. So I would like to draw our attention back to, the concept of RRE, recognition, responsiveness, euphoria. I would say that really just practicing as a parent to notice our child's efforts, whether or not they are successful is not the point. It's really more about, the fact that we see them trying and then validating that, drawing attention to that, drawing attention to efforts regardless of the results is the first thing. And the second thing would be to then kind of teach the child to be embracing of their sensitivity, of themselves. The third thing would be to teach them to set boundaries and limitations, because a person who's highly sensitive is prone to getting overwhelmed. So they do need to have strong boundaries so that they can kind of regulate and recalibrate their internal state in a timely manner so that they don't become overwhelmed and then externalize or internalize it in an unhealthy fashion.
Right. So for kids, would that be something like, having that self-awareness of how they're feeling and so on, and being able to say, you know what, I'm not going to go out. I need a break right now. I need some quiet time. I'm going to go to my room. And
and a lot of this language that excuse me, a lot of these are language that needs to be modeled for them. So that would mean, like I said, parents need to first be aware of the kids' effort. So for example, I see that you are trying very hard to finish this meal, but I'm noticing that, you are getting a bit fidgety or your mood is a bit low. Is it possible that you're feeling overwhelmed now or a bit tired? And then listen to the child and teach the child, well, if you're tired, you do need to set time aside and you do need to focus on resting first. So maybe we can set the meal aside and you can eat when you're feeling better. These are behaviors that you model for the child to first show them that it's okay to listen to their body's needs, to listen to themselves. So this breeds a lot more attunement to their own needs, and also they learn to trust their body and learn to trust themselves. Secondly, it's giving them that language that they can then use over the years to set the boundaries and also communicate that need to other people around them independently.
Yes, that's so important, I think, across all the different neurodivergent conditions, teaching them how to self-advocate and to be able to state their needs in an assertive but respectful way. So I thought maybe we can talk about, we've talked about what parents can do. What about professionals, about the support and intervention that you provide? What are some approaches that you've found helpful when working with HSPs?
Okay. So in my practice, I try to use a holistic approach. By holistic, I mean I don't just address, stresses from a psychological, intellectual perspective. I try to incorporate some somatic interventions as well to help the body with the regulation. So when somebody is overwhelmed, overstimulated, what happens in the body then is the nervous system gets dysregulated. So your nervous system basically controls and manages all your sensory experiences, right? And when the nervous system is dysregulated, it basically just adds fuel to the fire already burning. So when I focus, I notice that in sessions, a lot of my clients benefit from the somatic intervention. Specifically, I use trauma releasing exercise, TRE for short. It helps the body to naturally regulate itself by activating our tremor mechanisms. So the thing is, what most of us don't understand or don't realize is that our body is equipped and wired to self-regulate, to recalibrate itself. So what we do is we shake. So if you look at videos of people under stress, under duress, you will notice that they're shaking. So the person who developed this technique, Dr. David Bacelli, he first figured out this, the importance of shaking, of tremoring, when he was volunteering in a war-torn area. So when he was hiding out in a bomb shelter, he noticed that the children were like, da, 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 but then the adults were so still. So then he was like, what's happening here? He went to deep dive lab, basically. And he found that the tremoring mechanism serves to regulate the nervous system, gets the body out of the fight, flight, freeze state, which is the hypervigilant state, right?
Yes.
So that's the anxious state, stress state, whatever you like to call it. It's basically heightened stimulation. And extensive or long-standing exposure to this state causes wear and tear. It causes burnout. And when burnout is not treated, it then, develops into depression, anxiety, and your clinical and physiological disorders. So regulating your nervous system is very important. TRE has been very helpful. And I see that, for clients who persist in that exercise, they do immediately report feeling so much better, calmer. And that is actually them being in the parasympathetic state, which is the rest and digest state. That's the regulated state.
Right. Besides,
yeah. So then, other methods that are a bit more well-known will be like mindfulness, deep breathing. Yeah, but I find that with clients with perhaps ADHD or like severe anxiety, this sort of regulatory strategies may be a bit triggering for them, or it could be a bit boring, unsustainable.
Yeah, that's right. Yeah. Do you also use, is that a trauma releasing exercise as well, the butterfly?
So this one is really, is related more to, I think it's a bit of both. There are tactile stimulation. So there is, I think, some form of sensory regulation happening here. But more than that, the bilateral stimulation, the left-right tapping mechanism you see here is very helpful on its own to calm the emotional mind, the emotional brain, right? And we use this technique to process trauma in an intervention called EMDR, eye movement desensitization and reprocessing. Yeah. And so I use that typically to process the small T's for people with HSP or with any unresolved trauma, coupled with the TRE. So over time, what that does is when the body is in a state of perhaps equilibrium, homeostasis, then naturally the authentic self comes through. Your healing happens. And that's when you learn to kind of open yourself up to the possibility of embracing what you perceive to be your flaws in the past. Then you start to be open to learning. You start being open to your experiences, open to other people. And that is the start of repairing your relationship with your high sensitivity trait, and also repairing relationships with people.
Yes,
Yeah.
yes, yeah, that's so interesting, you know.
Mm.
So you really work with them a lot on a lot of these somatic exercises.
Mm.
Do things like CBT, would those things come in as well? Cognitive reframing, you know,
Mm.
but you would use those somatic exercises
Yes.
first to get them back to the
Yes.
equilibrium so that they're able to actually process and
Yes.
think about thoughts. And
Yes.
yeah.
Because the thing is, a lot of these techniques are very top-down approaches,
Exactly.
right? And
Yeah.
HSP people are already very
Yeah, they're
cognitive people.
overwhelmed.
Yeah, they're very overwhelmed, and
Yeah.
a lot of them develop this ability to. I mean, I'm just basing this off of my experiences, but a lot of them do have the tendency to intellectualize their experiences rather than feel them and experience them. And so it's sometimes nice to give your brain a break, right?
Yeah.
And also, if you're in a heightened state of vigilance, you're not open to learning. So what happens is you tend to find yourself getting stuck. So what a lot of them report is, I know this, I know I'm good enough, I know I've achieved a lot, but I don't feel that. I still feel anxious about being rejected. I still feel like, okay, there's something about me that this person doesn't like, even though I know I've achieved a lot.
So there's a disconnect between their thoughts and
yes. And I would say that the intellectualizing is intact, as in your ability to make sense of things is intact. It's not from a lack of knowledge and wisdom, but rather it's because there is a lot of dysregulation in the body that doesn't allow the person to start healing from the trauma and from the stress, from the all the grievances, the grieving that you have to do.
That's right. Yeah. Is there a particular age group? So, for example, TRE, you know, the shaking exercises. You know, what kind of ages onwards would that be appropriate for?
Okay, so for me, because TRE on its own as an exercise is quite time consuming, I would say you would need to do it for at least 15 minutes to feel the impact. For children who are too young, it's hard to get their attention and to get them to just lie there and go through the exercise. So, but then it works for them if they do. If you got the,
so if you got the compliance, than also efficacy,
and if you have the creativity to make it fun for them, great, even better. Then they get committed and they will follow the instructions. They will feel the benefits of it. I would say that there's no age limit to experiencing the effectiveness of the shaking, the tremoring, but it's really specific to the techniques, the steps in the techniques. It's most effective or productive for children who can follow and sustain their attention for a while, maybe 7 and up, I would say.
Okay, more like school age children. Is there like an assessment tool that you use, like an interview protocol or something?
So I do, but then this one isn't something that a lot of people use, but it is evidence-based. It is the Young Schema Questionnaire. So I use that questionnaire to figure out what sort of maladaptive schemas these individuals might have. And then from those schemas, I dig into their lifestyle and to their lived experiences. And that's where I can find a lot of unresolved trauma. And then we start processing from there after I formulate for them.
So for big T, earlier you talked about big T, right? And then the diagnosis that's associated with PTSD. For small T, is there any, or is more like these are small?
So a lot of them are, if left untreated, can develop or manifest into clinical disorders like depression, GAD, things like that. Even OCD. So even though OCD now has shown to have some neurological component to it, like genetic component to it, a lot of the environmental factors can trigger that
the predisposition. I see.
Genetic risk. So when we treat these conditions, or when we help to resolve these unresolved traumas, these small T's, then what happens is the person doesn't feel the need to continue with these behaviors that initially was used to kind of compensate for their traumas, right? So once the trauma is resolved, there is no more function to be served by these behaviors, then they resolve on their own.
And would you say the same approaches apply, like EMDR, TRE for small T as well?
Yes, I use them mainly for everything. Because so CBT and all that, cognitive reframing, they're very useful problem-solving skills. Yes. But it's hard for an individual to problem solve in the present moment if they're not in the emotional state or capacity to intellectualize. Yeah.
That's
So to get them into that state, we need to increase their emotional bandwidth.
Yeah.
And by doing that, so to do that, I use TRE and EMDR. So EMDR is an up and coming, not an up and coming. It used to be up and coming, but now I think
It's
a lot
pretty
of
established now.
yeah, pretty established. But like during the time, I think 10 years ago when I was starting to train in it, it was still relatively new.
Yes.
So I was quite surprised that not more people were using it because of its high efficacy. So now it's kind of getting more and more popular.
Yeah.
So it's good to see more, evidence in terms of quantitative studies, controlled studies to show its efficacy. So for TRE, you were inquiring earlier on, it's pretty much like what EMDR was like 2 decades ago or a decade ago. It is an up and coming technique. So there are a lot of anecdotal evidence, and there are new controlled trials coming up, new pilot studies.
Sure.
So however, I do acknowledge that because it's still a relatively new technique, there needs to be more controlled studies, more how do I say this? Yeah, quantitative control studies.
Yeah, like the gold standard RCT
Yes,
trials, which
that's
I think
right.
for something like approaches like CBT, because it is so programmatic. It's quite, you can have like a 10 session program, you can run them through.
Exactly.
The intervention is very easy to look at progress pre-post. I'm not sure if the same applies to something like EMDR. Because I think for programs where it's not very fixed, there's a lot of customization and adaptation to individual clients, it can be harder to get the kind of RCT level evidence, isn't it?
I think a lot of it will have to fall back. If you want to look at the RCT results, right, it will be still based on self-report, and it will be looking at, you will have to look at the other variables that you're measuring. For example, lower depressive symptoms, what else? Better life, quality of life, things like that.
True,
better school attendance, maybe if you're studying it among students, lower dropout rates, things like that. But for EMDR, I think qualitative studies and the results from that are very informative as well, because you get to see the participants' individual experiences.
Thank you so much, Amanda. I mean, I learned a lot. It's such an interesting conversation. Thank you for sharing all of that.
Excuse my rambling.
That's really good. So to our audience, if you've got any other questions for Dr. Amanda, please feel free to put it down in the comments below, and we'll see you at the next episode. Thank you. Bye-bye. Trust the adults. I'm sorry, that would be my daughter. It's okay.